Hi, I'm Janae Ryan. Up to a third of pregnancies end in miscarriage, many before someone even knows they're pregnant. After 19 weeks, the loss is considered a stillbirth. In Idaho, we see more than 100 of these a year. With this frequency in mind, I gathered a local panel of specialists on infant bereavement from St. Alphonsus and St. Luke's health systems. We do want to let you know that during this special, we share pictures documenting the short time a couple local mothers shared mourning with their babies. With their blessing and the support of the bereavement specialists, we're choosing to honor their experience and memories by showing them, including their babies' faces.
You feel alone in a lot of this, and I think the fact that all of you are here talking about having so much experience is that you aren't alone when you go through this, but it may feel like that, and your job is to help with that, right?
I think really just the overriding message that everyone's experience is very unique. There's no wrong way to grieve. Some parents haven't connected with a baby when they're pregnant, and so they feel very little of what we're talking about today. And that's fine too. That's very normal. That doesn't mean it's unhealthy. And some parents have named the baby like by the time they've peed on the stick, like it's really early. And they've already connected and they've painted the room, and they're very devastated about a loss at 10 weeks pregnant. And that's also okay.
Let's go into some of the things that are available to help a family through this kind of experience and are offered.
It's really based on the individual and what that family needs to help support them through this time. One of the things that I'm a part of at St. Luke's is helping families create a care plan. So if we know that baby may not survive delivery or long after delivery, trying to create a unique care plan, a birth plan for this family, what they want this to look like as best as we can, the meaningful aspects that we can bring into this family afterwards, allowing them time with their child, giving them resources, being respectful of what they need in that moment, I think has been a really unique perspective and really helpful for families.
And I know you were saying every care plan is unique, but can someone go over some options that might be in a care plan that is given?
We have had a family in the past that utilized a care plan to make a bucket list for their child, that experiences that they wanted to have with their child before she was inevitably going to pass. And we as staff tried to accommodate all of those things to the best of our ability. So they wanted to take her outside. We took her to the garden, and it was a whole coordinated effort to make it work. And so she got to go see the butterflies, and we had a birthday party for her so her family could all come in and meet the baby. And they wanted to watch movies with her, so we actually have a separate room space we can move families into to have more privacy and have time. And they brought their favorite movies and they watched their favorite movies with her. And so whatever we were able to do, we tried to accommodate to give them that experience that they couldn't, take her and leave. But we did as much as we could there at the hospital.
How do you communicate with so many people working in a hospital environment what is happening in this room versus that room, a loss room versus a birth room?
We have signage at the hospital, and I know St. Al's does too, but at St. Luke's we have a butterfly sign that goes on the door that really helps to communicate, even to the people that are delivering lunch, that when they come into the room, to be mindful that this family is experiencing a loss. And so that really does help our entire team kind of wrap their arms around this family and have an awareness of the gravity of what's going on in that room. We do have an onboarding course for all of our staff so that they have time away from the patients to really talk about this topic. A lot of our staff have had losses of their own, so that can be a really safe space for them to kind of work through their own emotions and how they're going to walk into a room and support a family and make it stay about that family and really stay in that supportive space so that they can be there for that family's loss.
We also try to be very mindful of where these families are at in location to what unit maybe they're on. So We don't maybe want to stick a mom who has just lost a child, a baby, on a mother-baby unit with all other babies. We want to maybe give them a different room that allows privacy, or what we have at St. Luke's is called the butterfly room, where we're allowing families to go into, it's almost like a nursery, and to be able to experience having that child with them and being a parent, because they still are a parent, and they will always be a parent, no matter how long their child was with them physically.
Janine, over the past 10 years or so, cuddle cots have come into play, and I know I've heard a lot of parents bring those up. Tell us about that addition and what they do and why you think they've gotten so popular.
When I had my loss 8 years ago, we didn't have a cuddle cot yet, and so it was a big deal for me to see our hospital bring those in, because it gives parents the gift of time. It allows them to stay with the baby longer, because it keeps the baby colder and it keeps their body preserved and safe for a longer period of time. It's a gift that I didn't necessarily get to have, so it was a big deal for me that we were able to start providing that to families, because it's such a short period of time. I mean, I held my son for a matter of hours, not even a full day. And so even another day or two would have been huge to me, because it's just, that's all you have.
Is there a time limit on what can happen with loss and stillbirth and the aftermath?
We really try to protect their time. Of course, they can't stay at the hospital for an indefinite number of days, but lots of families will want to stay for that full day or two and have the baby in the room with them after the baby has passed. And we really do try to support keeping the family together. We know that does help with their grief journey. Whatever we can do to make that time together special for them, we try to do that. But we do know that after they're discharged from the hospital, they're still on their grief journey, and try to put into place some things to help them for after they've gone home and they have to go back into their daily life, which can be really challenging.
And in these moments, there is no wrong question, right, or wrong answer or wrong request that you want to have happen.
Yeah, and normalizing that, you know, this is what some other families have done. Does this feel right to you? Is there something different that you would, you know, suggest that we do when you're leaving the hospital? What might that look like to you? And just gently, you know, listening more than you're talking oftentimes is the best thing we can do for families.
We've talked about how grief can be different for everyone and all the options. And for some people, that may be feeling overwhelming in that moment, or they have no idea, or maybe they say no to something and they might regret it later. How do you handle what's requested, what's not, how much they want, and how do you keep maybe encourage them to do some things they may not want to that you really feel from your experience almost everyone would later want?
I think one thing we do is we want to provide a safe environment for families to know that they can make decisions and choices. And then our role is to provide all the different choices and options, let them know that some families have chosen to do this, some families have chosen to do that. You can always change your mind. There's no right or wrong. It's whatever feels most important or right to you. So giving them those choices and honoring them and not providing any judgment either way.
Yeah, because some may choose nothing, right? Some might just want to get through this and move on. And Whitney, you've mentioned that sometimes you'll bring up that you can do it, but that doesn't mean you have to keep it with you. Tell me about that.
So thanks for bringing that up and talking about some different memory-making options for their child and for themselves as a family. Oftentimes we do photography or we offer photography. And I have had families in the past say, I don't think I can do this. But what I will say to those families is I have yet to hear from a family who has regretted having those photos or having the opportunity to eventually look at those photos. So they may stick them back somewhere else for a while, but then they may bring them forward into their grief process at some point in time. And it's okay either way. I just want to make sure people have the options and the opportunity and know that you can do what you want with them.
One thing I encourage families to think about is, you know, practice talking about your short, your medium, and your long version of your story. when you leave the hospital, you go back out into the world with work and, some strangers that, realize you were pregnant and were expecting you to bring home a baby. And so those are triggers. Those are overwhelming. And so what can you do to practice thinking about how am I going to tell people the story of my baby? And it's your own story. You don't owe that to anybody, but just practice. And that's a tool that we encourage families to think about.
Mm-hmm. And what about the non-birthing parent that's there, or the support person? They go through a lot in that moment. They also lost a child that they would love. And then they're also trying to be there for the person they love who is going through the grief. How do you support that person? How do you see that person and acknowledge them through that so they don't get lost?
It's hard to watch somebody you love go through a heartbreaking experience. Physically, emotionally, you feel that you're not helping in any way oftentimes. So giving them the choices as well. What do you want to do to be a part of this birth experience or after? What do you want to do to help care for your little one? Do you want to cut the cord? Do you want to help give a bath? Do you want to help us with footprints? Those choices validate their role. And we have materials, support materials that are specific to another partner, grieving together as a couple, grandparents, so that they feel, that they have the ability to grieve as well.
Again, I think that whether you are going to be an aunt or you are an aunt or you're going to be a grandparent or the mother or the father, you're grieving this loss of what you had hoped for, what you had dreamed about, and what you had expected.
And then what about out of the hospital with the people that surround them? How do you facilitate them having support?
For me, a lot of times that happens maybe when they're inpatient and I'm kind of talking to the families and really trying to empower the mother or the partner, the father, whoever is involved. What is their capacity right now? And again, like you said, is there a point person that can take on some other tasks? Whether that is contacting a funeral home for you, whether that's contacting your OB and letting your OB know, hey, we have a follow-up appointment, but mom would like to just come in to go to and request to go back to a room instead of waiting in the waiting room? Or can we just drop off food? Or helping to create a meal train, taking some of those decisions out of the hands of the people who are grieving, I think can be really helpful and impactful. And just doing practical things, showing up.
Mm-hmm. And I know in our conversations, you've mentioned that too, how to show up, but not in the way, or not giving the burden of choices to someone who can't handle that right now.
Yeah, so making non-obligation favors. So you can say to a family member experiencing loss, I'd like to come drop off some groceries. When would be a good time? Instead of saying, how can we help you? Or just let me know if you need my help. Because then it puts a huge amount of pressure on that person to first think of what they could need and then try to figure when it would be not inconveniencing the other person. There's just a lot. And so they're just going to not ask for help more likely than not. So giving a concrete and simple task, like I'd like to come clean your kitchen. You don't have to talk to me. I'd just like to come in and come out if that would be okay. Or I'd like to take out your garbage, or anything simple that you know that everybody needs help with. Everyone needs groceries, everyone needs food and cleaning. So something that you can take that burden off of their plate and do it in a way that's not going to, make them uncomfortable or make them feel any kind of obligation to communicate with you unless they want to. And you can say, I'm here if you need to talk, but also you can just ignore me.
Taking the initiative needs to be a big part of helping them at this point. What do follow-ups look like? You were talking about putting a care plan together, but then how do you follow up on that care plan and maybe other options that could happen later? Is there a process that follows through after the initial run-through of a care plan?
Yeah, so we have a whole team that is aware of the situation that has gone on with the family. We've all introduced ourselves to the family, and we've offered the option to do follow-up. So when they go home, some families decline, and that's their right. And if they do want that support, then we can offer a follow-up phone call. That might be with our bereavement staff. It could be with lactation services, because that can be something that people aren't anticipating. They often will have a follow-up with their midwife or their physician. So we provide that continuous of care with our team down the road.
Yeah, that collaboration between medical doctors and working with a bereavement specialist, how does that interaction work? Coral, you probably have experience there on both sides. Where is the handoff? Is it all collaborated through from, how does that process work between the two worlds?
In our NICU, we have had in the past committees that are specifically for bereavement related purposes. And so it's a dedicated group of individuals that want to work on bettering our process. But a lot of once the family leaves, that communication, that support then is funneled through Christina. And I know that St. Alphonsus in the past has offered support groups. We've had trying to conceive after loss groups. We've got a Facebook page for lost families. So a lot of that communication and support then looks more like a community approach of like-minded individuals getting together and talking about their experiences.
Seeking support from other parents has typically been, I think we can all attest to, that's the community that helps people the most. Those are the places where you will hear things like, get off of the emailing list, get on the unsubscribe list. It's triggering to get Pampers things in the mail or mailers because you're no longer pregnant, but when you got pregnant, they put you on a list. So those are the tiny things that other parents will understand that that's really difficult, and it seems like something very small. But that might be hard to navigate, and it's hard for everybody to navigate.
And then that would also be a reminder you're not alone in what you feel, and you can reach out about any little thing, but hey, is this okay? I feel like this, and just getting that acknowledgement, like, I see you, I felt that too, or I didn't feel that, but I understand. What are some of the resources that go beyond the hospital walls to help these people that you might connect them to?
One of the things that we've done for the last almost 20 years is we have an annual ceremony, and that is for anyone, no matter when or where your loss occurred. We gather together. We have a garden where we have the opportunity to say, who are you here for? What brought you here? And this is where we have families who had a loss 2 weeks ago or 40 years ago. And then we release butterflies. We have roses that we place down. So having that opportunity to have a ritual gives that acknowledgement again to the family that this occurred and that they have a community that are also experiencing some of those same feelings. So we continue to do that each year.
And we do something very similar at St. Luke's. We recently just had our Children's Evening of Memories, and so a time to bring together the community and some staff members to reflect on the children that we have lost in our community. Again, no matter what age, no matter what has been going on. And then there we're able to have the family come up and tie a ribbon on the tree. We want them to be able to say their child's name. I think that is something that's really important, is saying that child's name. That name is meaningful, and it was provided to them by a very loving family for a reason. And so being able to just, like Christina said, bringing that community together, having other families there who are going through or who have gone through similar situations has been really impactful for these families.
What about space to continue to honor the loss? I know there are some plots in local cemeteries. Can we go into that too, how you are also allowing more ritual for remembrance?
At St. Luke's across our system, we do have some locations that have free burial sites, and we do have a quarterly service there where our spiritual care team, they do a lovely job of having a little ceremony and inviting all the families that have had a loss. And so that's not for everybody, but it's definitely available to them, especially if they are experiencing some financial constraints. It at least gives them an option for that baby. But everybody really does have a variety of ways that they want to remember that baby. And so If they have something different that they want to do, we can certainly support them in that as well.
Another opportunity I find that many families feel is rewarding is that they give back on maybe the anniversary of their baby's birth date. They provide more support mementos, comfort items for other families who are experiencing a loss. So I feel that that is another way that they do acknowledge and give back.
Yeah, Coral, you do that in memory of your loss. Tell us about why you chose to do that and the kind of connection that brings for you and the families.
I think that one of my biggest fears as a new parent, this was my first child that I lost, was how do I keep my child's legacy alive? How do I continue to hear his name? Because after a while, people stop talking about your specific loss and they don't bring it up anymore, I think out of fear of not wanting to make you upset. And I was afraid that people were going to forget his name. And so for me, every year, the community supports me in such a beautiful way of donating all kinds of items, pamper items that I put into bags, and I give them to Christina for bereavement, and then I also give some to the NICU families as well. And that is a way for me to allow him to have a legacy, which is, I think, the most that I can do for him as a parent. I feel it's my responsibility as his parent to give meaning to his life as well. And it gives me a sense of peace knowing that his life can bring a small bit of comfort to someone else. And that helps me grieve and that helps me heal.
And I've heard many moms who have lost say, it doesn't hurt me to talk about my baby. I want you to mention them. I want to remember them. I want them to have been real to more than just me. How do you approach that situation near the beginning? How do you know if this person, this mother, this parent is wanting to talk about it yet? How do you say their name in a respectful way to start off with? How would you do that?
Asking them right off the bat, I would really like to honor your story and your child's life. What would be an appropriate way for me to do that? What would make you feel supported and not uncomfortable? And then you open that door, and then you know it's okay for me to say their name, but they don't want to talk about it. But later they may change their mind, but always asking them what's appropriate for them.
And I think for myself, what I often like to do is ask about the name. What's the meaning behind the name? I think when someone is pregnant or a family is getting ready for a baby to arrive, we all are thinking about what that future looks like for our child, for our family. Even if we're not grandparents yet, the grandparents are thinking about, oh my gosh, in 10 years, I'm going to be watching this little girl at a ballet recital. Or if I was the mother, I may be thinking about, I wonder if they're ever going to get married, or I wonder if they're ever going to go to college. I wonder all these things about my child who is still in utero. And I really like to ask, tell me about the name. And oftentimes families, they'll have funny stories. It was a meaningful name because of this. Or we couldn't decide, and once the baby arrived, this was the most fitting name, and this is why we liked it. But then that opens kind of the door to continue to talk about their child who is a person and who is of value.
And I want to mention too, there's no amount of grief and no amount of giving after that is necessary, right? Like we've mentioned, if you're someone who's had loss and you just wanted to move on, that's okay too, right? And you see that, I'm sure. How do you honor those kind of wishes and how do you approach that kind of person?
Yeah, one of my favorite phrases that I remind staff that are caring for families of is the need to grieve is directly related to the importance of what was lost. And that is going to be unique for each and every family, and letting them know that that's okay. And we will support you in whatever space or way that you want to acknowledge and validate, but we recognize too that it's different for every family, and that's okay.
What else should loved ones of someone who's gone through this kind of loss know about this time frame?
Remember down the road, due dates and holidays can be an overwhelming time for families, and they may feel that the support, the asking, the questions, the care just feels like it drops. So don't forget, it's intense in the first few days and weeks and months, but also in the years to come. Just how I'm thinking of, so-and-so today. I'm thinking of you. How is today going for you? Do you want to talk about it?
Also, for people that need help, to try to reach out to get help. And if you are a loved one of someone who seems like they need help, but they're maybe too numb to reach out, maybe reach out on their behalf and get them help.
How do you not disrespect their autonomy of their decisions in that process?
That's hard.
Is that a different for every person kind of thing again?
Yeah.
Yeah.
That's probably one of the more difficult things to navigate, I think, for healthcare workers. If parents really don't want to do anything, we really do need to respect their autonomy as an individual adult. And so we really can just give them information and give them as much access to resources as possible, but not make the decisions for them. And that can be difficult for families to navigate, much more so than the medical community.
And I also think, in general, I just try to remind myself and staff that people are doing the best they can with what they have.
What kind of advancement have you seen in this field over the past couple of decades of your experience in it?
I would say one of the biggest changes we've seen is that families are wanting to validate and acknowledge this type of a loss, where in other generations it wasn't something we talked about, and more families are wanting to acknowledge and give some ownership to this experience.
I would agree with that wholeheartedly, and also add that I think we're getting better at acknowledging that families have a lot of differences in how they grieve, and really helping them to sort of craft the things that are helpful for them as they're experiencing their loss, and really make that experience more unique to their family, so that it is more meaningful to their family. So I think we're doing a better job of listening to families and becoming a little bit more flexible with what we can offer while they're in the hospital, and then when they've gone home as well.
Choices, it
Lots
sounds
of
like,
choices.
is
Yes.
what the big difference is now. Choices and acknowledgement that it's happening. And you've told me about even people who have had an experience of loss in the past coming to support a loved one and then going through their own grief that they never got to feel.
Yeah, I think we've both had experiences very similar to that, where maybe a grandparent comes in to support their daughter who's having a loss potentially, and really has a lot of triggered feelings about their loss that occurred a long time ago, and makes comments about the fact that it was very different when they had their loss. And so that is a time when we can connect with that grandparent as well and try to provide some support to them as they're going through that journey still, really, after all that time.
How do you make improvements? Do you see that there is room for improvements, and how is this happening?
I think that there's always room for improvements. I will say I think part of the issue is just the American culture, not wanting to identify or kind of wanting to kind of put it towards a mental health aspect, that grief is a mental health issue. Grief is a natural process and part of life. And I think that's part of why we want to be here, is to share, like, this does happen often and frequent, and you are not alone. And how can we best support you in that? And so being able to hear from families, I know I've had personal experiences where families have come back to me and said, hey, this didn't feel right for me. And I appreciate that insight or that input. How can we make that better? How can we as a system or as a community make this a better experience for families? So I think feedback is always helpful, and then taking it up the chain to the right folks. Leslie and we're working on one right now, and just trying to make sure that we're doing the best we can every time.
Yeah, I think it's changed dramatically. I started working in the hospital in 1992, and so I think things are very different. We've become much more flexible in honoring people's choices, but to kind of echo what Whitney said, we always have opportunities where we can look to making a change that either takes something out of the scenario that is triggering for a parent or supports them in a better way. So that's really just constantly our process. And so hopefully every year that goes by, parents will feel more supported as they come through.
And you mentioned earlier too, when we were talking, that one thing you've added is a candle. And so you kind of get ideas in other ways as well of how to help with grief.
Yeah, we are very open to those opportunities to learn. Our paperwork, our trainings are never stagnant. They're constantly changing because we're always open to to knowing what we can do to offer to families to improve the support we provide. So it's every family is different. I think we've all had those opportunities to know, and I learn from every single family.
For more on loss and resources, go to idahonews.com. I do want to note a very problematic statistic. In 2020, Black women experienced twice as many stillbirths as other women. The CDC blames not biological or genetic differences, but disparities, poor access to health care, pre-existing health conditions, and structural discrimination. I'm Janae Ryan.